Taiwan, it doesn't cost you much to go see a doctor. Could you tell me why American healthcare is so expensive?
I can talk about it. I can try to explain to you why American healthcare is so expensive. First, all American doctors have to have insurance so they don't get sued in court. Most American doctors pay terribly high insurance rates so they don't get sued. This is part of the healthcare cost. The other one is some people in America have health insurance that is supplied by the place where they work. Some people don't. The people that have health insurance through work, when they go to see the doctor, they will probably get charged more to see the doctor than someone that doesn't have health insurance. So you don't, if I catch a cold and I have medical insurance, I go to see the doctor, and this is just, I'm just saying a number. It costs me $100 to see the doctor. I have health insurance. Insurance will pay the doctor. Someone that doesn't have health insurance catches a cold, goes to see the doctor, they pay $20. So the same problem doesn't cost the same price for everybody. That's part of it. And to give an example, what the difference in healthcare cost is, and this, I know this because it happened to me last year. Last year, when I was here on vacation, I had a kidney stone, and it really hurts. And I went to the emergency room in Taichung. I saw the doctor, they gave me some medicine. It cost me about $30 US to pay for my visit to the doctor, to get an x-ray, to get a sonogram done. If I'd have gone home, gone to the doctor in America, and gone to the emergency room and had the same thing done, it would have cost me $300 US. Before, that's what I would have paid before the insurance paid, and the insurance would have paid some too. If I come here and go to the doctor, I just say, how is it so cheap? I can't understand it. And why can't we have the same thing? I don't have answers to that. I only know that ours is expensive for several reasons. Doctor's insurance, those that have insurance pay more for what they have done, and those that have no insurance pay less. But if you have no insurance, it doesn't mean you don't get medical care. If you have no insurance and you go to the hospital, they have to give you care. But if you can't pay for it, what you can't pay for gets passed to the people that can pay for it, if you understand that. So that also raises the price of insurance. Will we ever have universal health care like you have here? Eventually, but I don't know when. Americans look at universal health care, and the place they look first is at Canada. Canada has universal health care. Canada is our next door neighbor. When people in Canada get sick, they come across the border to see the doctor and pay for it. Because my brother lived in Canada for 3 years. If you catch a cold in Canada, you're probably going to have that cold for 2 or 3 months, waiting to get in to see the doctor. If you really, if you have cancer in Canada, you go on the waiting list to get treatment. If you have cancer in America, you go to the doctor and you pay, but you get treatment. So their system has some problems also. Ours has some problems. I don't know. In your system here, I don't know how well they cover, we call it catastrophic illness, something that will take your life. I don't know how well they cover that. In America, if you have insurance, you get the treatment. If you don't have insurance, you still get the treatment, but someone else gets to pay for it. That's basically how ours works. Seems a little confusing probably, but I look at your system and wonder, how does this work? And it seems to work well.
My dad had cancer, and he got treatment. We didn't have to pay much. It was covered by the government.
My government needs to talk to your government to find out how this works. They need an example, and the Canadian example isn't a good one. What they have up there doesn't seem to work real well, because Canadian citizens that have cancer come to America to get treatment rather than stay home and get it free.
Oh, that's too bad.
You know, and that's not good, which means there's something wrong with that system. Yours here seems to work really well, and I have no idea how you pay for it.
My dad was really old when he had cancer. So actually he didn't pay anything, even though he paid so many visits to the hospital. Oh, one thing interesting I would like to ask you. I watched the TV series, Emergency Room. It's a very popular TV series. And I saw many patients sue their doctors. Is it very common?
It's common.
Oh,
In America, everybody wants to get, it's easy money.
oh,
That's why they do it. You know, there are lawyers that have advertisements on TV. You want to sue somebody? Call me, I'll help you. I get part of what you get.
okay.
You know, they advertise on TV to get lawsuits. You know, and the hospitals are the first place they look.
Oh,
If you're in a car accident, I guarantee you, you're going to be sued. I guarantee it. If someone gets injured in your house, you're going to get sued because it happened in your house. You're responsible. They're not. If someone does something stupid in my house and gets hurt, it's my fault. I'll be sued. It's not their fault that they were foolish. It's my fault that I let it happen in my house. That's the main reason why American medicine is so expensive, because the doctors in the hospitals, of every 100 patients they treat, 20 of them will sue. For a good reason or bad, who knows? They will sue them. Now, they may not win the suit, but the hospital and the doctor are going to have to go to court. They're going to have to pay their lawyers. It costs them money. And when they spend money, they pass it on to the patients. Someone has to pay for it.
That's the cultural difference. Here in Taiwan, it's unusual for patients to sue doctors.
In America, it's normal.
Oh,
Normal. I would say normal is the right word.
okay, I see.
And, you know, there again, that has to be one of the reasons why that medical practices cost so much in America. Now, the government has tried to put, they call it a cap on how much you can sue the hospitals for. The government's tried to do it. The insurance company stopped it. I don't know why, but they did. You know, they wanted a cap on how much you could sue the hospitals for. It didn't even get to Congress. It didn't even get voted on. It just got told no. Now, why? I don't know. It would have helped lower the cost of medical benefits or medical practice, but it got kicked out.